Hi everybody, this is Dr. Leslie Blevins with Enilda Clinic. You can learn more about me at enildaclinic.com. Be sure to like my page in order to get access to my videos as they're coming out, or join the mailing list, the email list at enildaclinic.com. Let's get started. So we are learning about psychological test scores today and what they do and what they mean and how they're used. All right, so psychological test scores are utilized by licensed psychologists and by school psychologists inside the schools. We're going to talk specifically about them in regards to your child and how you might learn about them when your child is tested. And so to start, I'm going to show you a bell curve. So a bell curve is a statistical visual to help us represent what our scores look like with a whole population of people that might be tested. So rather than your kid bringing home a test and earning between 0 and 100% correct, psychological test scores don't work that way. We are comparing your kid to other children of the same age in psychology world. And so what you can think of is the psychological test. The average score is the most common score. So this curved part of the bell curve is sort of like a blanket, and the higher it is in the middle is kind of like a football pile, or like an ant pile, where most of the people or most of the ants are lying in the middle. And then as we get out to the extreme ends of the bell curve, there are fewer and fewer people represented, and those extreme ends represent extreme scores. And so what we have over here on the ends are either very high scores or very low scores. And then right here in the middle, what we see is the mean or the average score. And so whenever we think about things like IQ or anxiety or language or aggression, pretty much anything that we can measure with people, we can measure it using a bell curve and thinking about most people having an average amount. And then as we get more and more of that quality, fewer and fewer people having it, or less and less of that quality, fewer and fewer people having it. So what we're doing in psychology world whenever we're thinking about psychology test scores is we're trying to identify patterns. And so whenever you first come in to a private practice or a clinic and you're working with a licensed psychologist, we do what's called an intake evaluation, which is about an hour-long appointment where we're going to talk to the parent and we're going to learn all about your child and where the distress is showing up for your child. And that is really important because whenever we are doing medical diagnoses for mental health or behavioral health, we are trying to figure out where is the difficulty showing up for your child, whether it's social skills or language and communicating, behavioral or social emotional, thinking skills or academic skills, wherever it might be. Those are very important for actually rendering a diagnosis. In the school setting, many times a school psychologist might either talk with the parent over the phone or invite the parent into the school. Sometimes they're actually sending home a questionnaire for the parent to fill out in order to figure out where the difficulties are happening at home. Now, the school psychologist isn't necessarily looking for impairment the same way that a licensed psychologist is, but they are looking for difficulties in the child getting access to the curriculum, because they're not working with the DSM, which is our diagnostic manual in the medical field. They're actually working under IDEA, which is a federal law that requires that all child have access to a free and appropriate public education, or FAPE. And so their criteria is a little bit different, but in a similar way, they are looking for distress for the child to be able to learn and access education within the classroom, okay? Okay, so we are looking and trying to identify patterns of extreme scores, and we're also trying to identify where the distress is happening for the child in their life, in the classroom, or especially for a licensed psychologist, we're also looking inside the family, inside the social setting, anywhere that the child lives, okay? So what we do with the licensed psychologist is we are then matching those patterns of extreme scores with already well-defined diagnoses that are inside the DSM-5, which is our diagnostic manual again. And so whenever we match the patterns of scores along with the reports that are given by parents or even teachers that tell us how the child functions, then what we know is that we can reliably give a diagnosis for that child that then tells us a lot of information about what we can expect for that child, but also how to treat that child. And so that's really important for us to give a good, accurate, and clear diagnosis that can also lead to good and accurate and clear and effective interventions. And then for the school system, again, they're working with IDEA, so a totally different system. They're not rendering diagnoses in most cases. I know some state laws will allow a very limited range of using diagnostic terms for children like dyslexia or ADHD or autism, and so many times those aren't actually diagnoses, but they're used to help maintain clarity among medical professionals, family, and the school. But on some very limited cases, sometimes they are actually rendering diagnoses. And so it's always appropriate for parents and for teachers to ask questions to make sure everybody's on the same page. But for the purposes of this general audience video, let's just go ahead and assume that your school psychologist is not rendering a diagnosis. They are strictly looking to see if your child is able to access the curriculum in order to receive services under a disability category for IDEA. And so there are three ways that they're actually looking to see, or there's three main types of ways. So every state and the districts under each state are allowed to choose the way that they actually define if a child meets the criteria for special education services. And so it's important to know that every single district is going to have their own unique process. There are certain federal rules and guidelines that everybody has to follow, and those will likely be followed by your school, but maybe within a unique process that they're coming up with to meet their state's rules and regulations. And so the three main ways that I think will help most people to have familiarity with what the school is doing. I'm going to go through those. So the first one is called response to intervention. So this one is not actually a part of psychological testing data, but it's a really important part of how children are sometimes vetted for special education. And it's a really important part of making sure that general education is giving good intensive instruction. And so this actually happens before the special education testing piece. And what it does is it's sort of using the data just like the regular test that your child brings home. And so we call these criterion tests because we're actually seeing if the child knows how to do a specific skill. And so we're seeing if they can meet the criterion for that skill, right? Like 80% mastery. So we are looking at 0% to 100% on those skills. And so with response to intervention, what we want to see is if, let's say in reading, for instance, a child is routinely scoring 20%, 40% on their test, then we're going to throw in an intervention that we think will be effective for that child. And after they've had access to that intervention, then we're going to see how they're performing on their test. If they're responding well to the intervention, then what we would hope to see is that their test scores start to go up. Maybe it's going up to 70%, 80%. That's a good response to intervention. That might not be sufficient. We might have to add on another intervention as well to really get them all the way up there. But that's what the school is looking at, the response to intervention. So next, something that your school might be doing is the discrepancy model. So the discrepancy model is where you're basically using the IQ score for the child as an anchor to say that this is what we can anticipate the child's performance to be like overall. And then they're going to look at some other key scores, mostly academic, but sometimes some social emotional scores like anxiety or depression. some executive functioning things that fall inside ADHD, stuff like that, to see if there's a big discrepancy there, because we wouldn't expect to see a child that has, typical good intellectual functioning to have big difficulties with reading. So if there was a big discrepancy there, something that's what we would call clinically significant, then we might say, okay, that kid has dyslexia, and we might start giving them intensive supports within the special education framework. The third way that some schools will identify children for special education is through a strengths and weaknesses model. So this one is actually looking at different cognitive strengths and weaknesses, as well as different academic strengths and weaknesses. And so it's trying to identify the patterns that go across the cognitive piece and the academic piece to see if there's a true deficit there. Let's take reading, for instance, where if that deficit is going across the cognitive piece and the academic piece, then we could start to say, okay, this is a reading difficulty, and the child does need to have some special services and special instruction in reading in order for them to be able to access the curriculum. Okay, so again, why are all these test scores important? And the reason for that is so that we can accurately identify what's happening for the child, so that we can give them supports that are targeted towards their true deficit. Okay, we never want to just label the child just for the sake of labeling, right? We want to be able to give them good supports so that they can start making progress in school, in home, in their social life, in their community, really meeting their values and their aspirations. So that is the video for today. I hope that you enjoyed it. Remember, this is just for educational purposes. If this spurred some questions for you, then please reach out to your local school psychologist or your child's pediatrician. You can always reach out to me too if you're local in Spokane, Washington. And I look forward to seeing you next time. Thanks.